Hi, my name is Amber, and this is my baby Beckett. He is my third, and he is 4 months old. We had his lip and tongue tie diagnosed at 2 months. We had his procedure done at 3 months, and ever since then, he has been eating better. He is not gassy. He's able to pass it. He doesn't have the issues. We still do chiropractic care. Since the lip and tongue tie reversal, he has been a completely different baby. My first, it hurt when he would nurse. Like my toes would curl. And my daughter never hurt when she nursed. She's the best eater. This one, from day one, it hurt. Like I had a blood blister by day 3, 4. And I was like, this hurts. Like this is not right. I deal with him all day long. I need to find something that helps him. Like I was going through a bottle of gripe water and Mylicon regularly. And I was like, something is not right. When I said, he's gassy, he has a hard time latching, he's super fussy. They were just like, oh, that's normal. He's a baby. Okay, fine. So then I was like, you know what? I'm going to find something else that maybe works. And so that was chiropractic care. So we were going there. But the reason I reached out to them was because every time he would eat, every time, he was starting to scream after he would be done eating. Like it was not just a little bit of gas and uncomfort. It was severe discomfort. And the pediatricians weren't doing anything. So I was like, there's got to be some natural way or something that I can do to help him. I was doing bicycles. I was doing everything. Nothing. So I was like, okay, chiropractic care. And then we went there. First couple of times I was like, that was magic. Like he's better after that. He slept. Like he took an hour-long nap. Like, guys, he's sleeping. But then every time, I mean, we knew by day like 3, I was like, all right, when are we going to see the doctor again? Like, when are we going to the chiropractor? Like, how many more days till our appointment? We'd go see her. It was better. So when she was like, he keeps, his right side is tight every time you're coming in. And usually I don't have to see infants, but maybe once or twice a month. She goes, I'm having to see him every week. And then she was like, I don't diagnose him. She goes, but I think I see a possible tongue tie. Joy just made me feel so comfortable. She knew exactly what she was doing. She looked in his mouth and she affirmed all of my concerns with him. She said, no, that's exactly what this is. And she showed me, she was teaching me immediately, like day 1, before anything was really even scheduled, how to stretch his mouth, how to do all this. She just made me feel heard and very comfortable. Like she was like a best friend saying, no, this is exactly what you need. She just, like she fit right in. I just met her, but she made me feel like this is 100%, no questions asked. Do I need a second opinion on this? Because she was so confident and comfortable to talk to about the whole situation. Bringing him in for the actual procedure, of course, as a mom, you're just, your poor baby, he has to go through something. But she said, you can leave the room as soon as we get him ready. And then as soon as he's done, we'll call you back. Okay, so I go out into the waiting room, I can hear him in the back, and it was fine. I go back there, and by the time I had him back there, they already had him, he wasn't even crying. He was perfectly fine. I held him. He was good. And then I went from here because I was like, I don't know. I live probably about a half hour, 45 minutes from here. And I was like, I don't know how he's going to be in the car. I want to be close to him. So I went and walked around the mall for a little bit, and he slept. Like an angel, he slept. And then he woke up, it was time to eat. I fed him without a nipple shield. I didn't even need the shield anymore. He was immediately, I could tell he was better. And I was like, this is amazing. Like he didn't use the shield from the first feeding.
The very first
feeding.
After his
he latched. I haven't had to use the shield since January 10th, the day he had his procedure. I've not had to use the shield on either side. When you know in your gut that something is not right with your baby, it's okay to go for a second opinion, a third opinion. Ask somebody else what might be wrong. Or if you think it's something, find who you go to and bypass the one that said no. Because not all the time are they going to have the answer. As a mom, we know when something's not right. Yay, I did it! I did it! I'm so happy. I'm so happy.